Okay, hello everybody. I'm here to demonstrate to you how to give a concussion exam. This is a very important topic as concussions are more prevalent in sports today now than they ever have been. A concussion is a blow to any soft part of the body, especially to the head though, according to Merriam-Webster Dictionary. So, observation is step one, according to sports care athletic trainer Devin Spears. Observation and recognition of concussive collisions is the most key step in concussion assessment. A concussive blow will occur when a player leads contact with the crown of their helmet or top of their head, or the head bounces off the turf. Once you see one of these blows, it is your job as an athletic trainer to remove the player from play. But before you remove the player from play, you want to look for some telltale signs such as inability to stand after contact, walking to the wrong huddle, clutching of the helmet, or signaling to the sideline for a substitution. As a trainer, once you see these, you want to grab the player from the field, remove them from the field of play, and once they are removed from the field of play and you see them, the visible signs like they may be staggered, they may be experiencing some sort of dazed look, you want to take them to a quiet area, which for today will be our classroom, so Mark will stand right here. And you want to begin step two, which is the interview process. This is a very critical part as it will help you gauge verbally what your patient is experiencing. Do you remember the hit?
No.
Do you remember losing consciousness?
No.
Do you know what team you were playing?
No.
What's your name?
Mark.
Okay. So the answers to these questions are pretty prevalent because if he remembers the hit, it's likely to be a less severe concussion. If he doesn't remember the hit, it is most likely a severe concussion. Regardless of the results, you want to move on with the assessment. So step three will be the light sensitivity and balance test. Unfortunately, this light does not work, but it was given to me by head athletic trainer at Shenandoah High School, Rick Nizick, who says that this pupil dilation gauge is perfect for the job as it's right on the pen, and the light is not large enough to cause damage to the athlete's eye. I will now ask Mark to follow the light as I move slowly up, down, back to the middle of his field of view, left, and right. As I make these motions, you can stop on the light, thank you. As I make these motions, I investigate dilation of his pupils. If his pupils are over-dilated or too large, he most likely has a concussion. If they react to the light accordingly, such as shutting down to let less light in, then I know that he most likely does not have a concussion. But regardless of the results of this portion of the assessment, you want to move on to the final part, which is the balance test. So I will have Mark stand right here in the middle of the class. Bring your feet together so that your big toes and your heels are touching each other. Bring your arms to the side with your palms flat to your hips. Now look up for me. As they stand in this position, I will observe to see if he struggles with any type of balance, has a stagger, ask myself some questions like, does he look okay? If he looks okay, continue with the assessment. If he does not, sit him down, they have a concussion, they need to see the team doctor. So now we move on to the next part of the balance test. So I'm going to ask Mark, I'm going to ask Mark to maintain his position, but while he maintains his position, bring his arms up in a T formation so that his arms are parallel to the ground, and look up for me. Now I'll give a 5 count to see if he can balance. 1001, 1002, 1003, 1004, 1005. Okay, you can relax. He looked good at that part of the test, so we move on to the next part. And as similar in the previous part, if he struggles with that, sit him down, have him see the team doctor. So the final part of the balance assessment, I'm going to have him maintain the same position with his arms in the T position and his eyes up to the sky. I'm going to have him raise his non-dominant foot 2 to 3 inches off the ground, so just a little bit. 1001, 1002, 1003, 1004, 1005. You can relax, okay? Other foot, please. 1001, 1002, 1003, 1004, 1005. Okay, and by this process, I can tell whether or not he has any sort of balance issues. This will expose players who are trying to hide their symptoms, as they will struggle and fall. After you're done with this part, if they have passed all prior parts, they are clear to play, with usage being at discretion of the coach. If they have failed any portion of this assessment, they cannot play, they must see a team doctor. In conclusion, I firstly showed you how to properly witness or recognize a concussive hit and remove the player from play. I then showed you how to take them to a quiet area such as a locker room, a gymnasium, or a training office, and then assess them with further interview questions. And thirdly, I gave him the light sensitivity and balance tests. This is a very simple task that I hope you have seen some insights into the process of how to perform this so that you can bring it to future use should the need arise. Here's hoping it doesn't. Cheers, and thank you for your time.